weeks this week, and I just wanted to do a real quick update. So first things first, I'm almost done with my Hypnobabies course. I'm on week number 5, and then after I do this week, I will just have the maintenance up until the big day. I got the tracks onto my iPhone finally, so that's made it easier for me to do the hypnosis every night, and also it'll be much easier for me to be able to utilize them when it's the big day. I got the birth partner disc included as a separate disc, and I've got that onto iTunes for Justin to put on his phone, and then I gave the disc to my doula so that she could also listen to it. And I need to also get her copies of some of the paperwork that are for the birth partner as well, so she can look over those. So I saw her this week on Monday at my prenatal appointment with Dr. Andrews. She came for some moral support, mostly for helping handle Kaladin. It turns out that I was right in that when I'm stressed out about his behavior, it makes my blood pressure worse. Like I said on my last update, I left him with one of our neighbor friends to babysit him when I went for that blood pressure check on Thursday on my birthday, and my blood pressure was fine. So then Dr. Andrews said, okay, you're good to go, see you on Monday. So she had messaged me and asked me if there was anything I needed that week, and I was like, actually, you know, are you free on Monday to come to my appointment? And she's like, oh yeah, totally. So she came with, and she was able to help try to keep him entertained and whatnot, so I wasn't worried about him trying to run off or something when they took my blood pressure. Now, the funny thing is, the first time she took it, Cal wasn't even back there yet. Rebecca was still working on getting him back into the stroller and over into the next area. It was busy this time as well. Last week, the whole waiting room was full of people. This time, there was only one other person in the waiting room, so I thought, awesome, we're not gonna have to wait a long time. We still had to wait at least 30 minutes, probably longer than that. That was the last time we looked at the clock. So he, you know, was getting antsy. He was looking at books and whatnot, but he wanted out of the stroller, and we were letting him do that. But she had to get him back in the stroller so we could go back to the room. So she was still working on getting him, so I was just there with the nurse by myself getting the blood pressure taken. So you would think it wouldn't have been bad at all. But the first time, it was 151 over 101, I think, something like that. And I was like, no. She's like, let me try it with the other cuff. So she took the other cuff, which I think is bigger, and put it on my other arm and took it, and that one was interesting. It was 113 over 84 or 86. So the bottom number is still a little teensy bit high, but not bad. But the top number is the lowest it's been the whole pregnancy. So I was like, interesting, okay. So she's like, yeah, that's more like it, that's good. And she wrote it down, and I gained exactly 1 pound. I think I'm up to 38 pounds overall. So this is just interesting to me because I've gained so much more than last time, but I also started out a lot thinner. So I guess my body just likes ending up around that same area. As far as the ending weight at the end of pregnancy, you know, regardless of where I start, it wants to end at the same spot. But he said my weight was fine. A pound a week is about right. I had a little bit of a jump a couple weeks back where he just said, you know, watch your weight. But he's also been mentioning the past couple weeks that he thinks a lot of it's water weight, since it was right around when I started swelling a little in my feet. And he said the water weight will come right off, and that doesn't count, you don't have to worry about it. So the blood pressure's fine, still nothing in my urine, still no headaches or vision changes, no swelling in my face, I don't think. Do I have swelling in my face? I don't think I do. Not really in my hands either. My wedding rings are a teensy bit snug. Like, I have to, like, you know, really wiggle them to get them off, but I can still get them off. So I don't really consider my hands swollen. They definitely don't feel swollen at all. Even my feet aren't so bad. Like, it doesn't indent or anything when you touch it. They're just a little bit swollen. So they're, yeah, they said that's totally normal. they're not worried. They worry about face and hand swelling and like the really bad headaches and that kind of thing. So we're still doing well. I measured back, last time I was a week behind on fundal height. This week I was right back on again. It measured at 36. Heartbeat was great. Down the lower left, so I had a feeling, I think she's head down, and you know, I had been feeling what felt like her butt up here, but I wasn't real sure, but it felt like it was too big and not quite round enough to be a head. And also when I poked at her to try to like figure out like her position, she'll move away, like she doesn't like it. She's always like, what are you doing? And it will kind of slide over, and I'm like, if that was her head, I don't think she would move it that way. So I was pretty sure, but not positive. But Dr. Andrews did palpitate, and he said yes, she's definitely head down. He felt her head down deep into my pelvis, and then felt along. And so, yeah, she's definitely not only head down, but anterior facing, which is also great, and hopefully she stays that way, because it's much easier to push a baby out in that position. So that explains lower left for heartbeat, because, you know, heart's on the left side. Anyway, he kind of felt around. It was a little bit uncomfortable. It didn't hurt too bad. It's a little bit uncomfortable. But he said, he's like, you know, he was estimating her size, and I was just like, okay. When he was feeling, he's like, she is exactly, precisely, approximately not small. He's just funny. So he said if he had to guess, maybe 7-ish pounds, and he said that that's about right considering what Kaladin's size was at birth. He was 8 pounds 11 ounces. But yeah, I'm not worried. I don't have teeny tiny hips, and it really is uncommon for a woman to grow a baby she can't push out unless she's got uncontrolled gestational diabetes or had a previous pelvic injury or something. I mean, it happens, but it's definitely not a common thing. So chances are very good that even if she's on the larger size, that I would still be able to push her out. So I was really happy about her being head down, like yay, because I know this would be about the time that they would start to be concerned if she wasn't. I know it's still possible, knock on wood, that she'll flip back out of it, but chances are pretty good that now that she's head down, she'll stay head down, especially because it feels like she's pretty low. The other awesome thing is I am group B strep negative. Yay! So that's one less thing to worry about. I was reading up on that last week and getting a little bit worried, just because the main antibiotic they use to treat that is penicillin, which I'm allergic to, and the next one that they use is clindamycin, which I take often. Since I'm allergic to 3 types of antibiotics, that is one that is most often prescribed to me, and that's a lot of why I reserve antibiotics for when I really need them, because I don't want to develop a resistance to them and then have that be an issue when something is serious. So, you know, small things like ear infections and whatnot, I try to treat them naturally first instead of going straight to antibiotics, and that usually does the trick for me. But anyway, since the GBS, it's kind of like a preventative measure, and not that you necessarily need them. I was really not looking forward to potentially having to take antibiotics when they weren't truly necessary, and have that, you know, contribute to that resistance and also make us more susceptible to thrush and whatnot. But I'm negative, so it's not an issue, so I'm happy about that. So he said at my next appointment that if I want to, we could check and see if I have dilated any. Obviously, we know that it doesn't tell you anything about when you're going to go in labor. It doesn't tell you anything on if you're capable or not of going into labor. So, you know, if you're at 39 weeks and you're not dilated at all, doesn't mean that your body doesn't know what to do. Nor does being 4 centimeters at 38 weeks mean you're going to have the baby anytime soon. You could still walk around for a month that far dilated. So, his main reasoning, he thinks the benefit of it is just to know where you're starting off from, which I agree. I'm kind of curious myself. So he said, for example, you know, if he's checking in week to week and we know ahead of time that I'm already starting out at 5 centimeters dilated, I'm probably not going to want to wait till my contractions are 5 minutes apart for 2 hours before I go to the hospital, because that might be waiting too long. I totally agree with him on that, because I've, you know, been kind of agonizing a little bit on how I'm going to know the right time, especially with my photographer being an hour away, and especially with doing Hypnobabies where I might not have the same kind of signs that you might be looking for as far as like the emotional markers, not being able to smile between contractions, you know, the noises that are made and the pain levels, whatnot. Like I might not have those factors to be able to glean from. So I was always, I keep talking to my doula about it, like, when am I gonna know? When am I gonna know? And I've just been trying to pray on it and kind of have some faith that somehow, some way, she or I will just have the instinct to know when it's time to go in. But if we know ahead of time that I have 8 centimeters to go or only 5 centimeters to go, will also be a helpful factor to consider when we're deciding on that timing. You know, if I'm farther along, you know, 4, 5, 6 centimeters to begin with, then I'm not going to want to wait very long to call the doula or the photographer or go into the hospital. Whereas if I'm only 2 centimeters when I start, then I know I could probably have a long way to go. Especially these days, ACOG has been looking at the statistics of birth and how fast women dilate, and it used to be thought that 4 centimeters was the start of active labor. Now it's considered 6. So things can take a very long time from 0 to 6 and still not have it be considered failure to progress. So I'm just kind of curious, and I think that'd be helpful to know. So now I just need to decide when I want to start checking. So we could start as soon as next week at 37 weeks, or I can hold off. I definitely am not worried about being disappointed if there's a lack of dilation, because I know that doesn't really mean anything, and I'm not worried about him using it against me as like, see, your body doesn't know what to do, because he's definitely not that kind of doctor. And I know that it's not like a crystal ball to tell me anything about when she's coming, so I don't really feel there's as much risk to doing it as there's sometimes for people, because sometimes women get really disappointed at lack of dilation, and so that's one reason they just avoid getting their cervix checked. There is the risk of infection to consider, but if, you know, intact membranes, washed hands, gloves, it's a low risk. I mean, he's not telling me not to have sex with my husband, and, you know, I'll just leave it there. Anyways, so that's what's on the horizon. So I've got my next appointment coming up Monday. Lastly, what happened in the last week is I did go to the labor and delivery tour at the hospital. It was just interesting to see, you know, what the rooms are like and get kind of a feel for what the hospital procedures are. They're working on getting their baby-friendly certification, so they're really big on keeping the baby with you instead of in the nursery. Their goal is to have at least 23 hours of the day having baby with mommy, and they are real big on skin to skin immediately for at least an hour following birth. I did ask if it's an option in the OR. She said that it's up to the doctor, and I told her, well, my doctor told me it's up to anesthesia, and she said, well, I suppose it's an option, you know, just ask for it. But worst case scenario is their usual protocol is to have it in recovery, which is about 30 minutes following birth, which is still miles and miles better than what happened last time. I did get to do it for 9 hours, so 30 minutes is much, much better. The other development is the friend in the neighborhood, Natalie, who Cal went to last week while I was getting my blood pressure checked, offered to watch him while I have the baby. So that is really helpful, and I actually do feel okay about it because I've left him with her a couple times so far, and he really likes it over there. Last time he was really upset to leave when I picked him up. He does not cry at all when I drop him off. He has a great time with her boys. She loves having him there. She said he always behaves really well, and she loves how smart and verbal he is because her son's a little bit younger. So I think it'd be a pretty good option. I would feel bad waking her up in the middle of the night to bring him over, so I probably would just bring him with us if it's the middle of the night. If it feels right that we have her there, and she's right around the corner, so we just drop him off on our way over to the hospital. So I'm just gonna pack a bag for him in the event that he won't be with us, just in case. But even if we take him with us, he'll need mostly the same kind of stuff anyway. So now I can just kind of wait and see how it goes. If while I'm laboring at home, if he's already getting really distracting, I think, probably shouldn't bring him with us. It'll be nice to be able to have more than one option instead of just being stuck with having to bring him no matter what. Still working on getting the baby stuff ready. I've gotten about half the diapers prepped. And I did finish my birth plan this week. I have it consolidated down to one page of bullets for, environment, labor, delivery, newborn procedures. Then I have a separate page in case of cesarean that we'll just pull out if it comes to that. So I'll have like a longer version for my doula to hold on to, and then we'll have that shortened version for the staff so that they can look over it quickly. And I just really consolidated it down to things that kind of go different than usual. So like I didn't put on things that were standard for the hospital. Like all the rooms are private, so I didn't need to ask for that. The skin to skin stuff like that is a given, or that I've talked to my doctor about, that I know that's how he normally does it. I just left it off. But little things like hey, I'm doing Hypnobabies, so please keep your voices quiet and the door closed and lights dim, and these are the words I prefer to use instead, like don't use the word pain, that kind of thing. So I'm glad that that's done, because that's pretty important. Last time I had it done, but I hadn't printed it out yet. So this time I am printing it out right away, a few different copies, and packing it in the bag. I have to pack my hospital bags. I'm going to be doing that in the next couple days, so I will do that on my next video to show what's in it. And I have to wash the baby clothes, and I still have to wash like the car seat and stuff and get that installed. So anyways, still lots to do, so hopefully she stays in there for at least another 2 weeks. I think it's kind of helpful that I still have so much to do, because it makes me less anxious about her coming, since I've been so miserable with the heartburn and the insomnia and the pelvic pain. So miserable. I'm still like, but I don't want her born yet. If I had all these things done, then I'd just be so, I just feel like I'd be that much more miserable and just counting down the days and just hoping she'd come and being mad when she's not coming if I didn't have all this stuff still left to do. So anyways, that's all I have to talk about this week. I will catch you guys next week. Bye!